The current economic crisis demonstrates how important it is to reform the healthcare system. We need to ensure that people needing care get the healthcare they need at a price they can afford.
This is not an issue, a political issue. It is an issue what is best for the people. What is best for the people is that we all have healthcare insurance.
Healthcare reform cannot wait, it must not wait, and it will not wait another year.
We now have an unprecedented opportunity to make the healthcare system work and to contain out-of-control costs. Today's conversation will give you and your neighbors a chance to review some of the options that have been proposed to fix our healthcare system and to send a clear message about what you think must be done. In order to start this discussion, we need to understand the nation's and California's healthcare crisis. Healthcare costs in the U.S. are expected to reach $2.6 trillion in 2009, or 17% of the gross domestic product, and is expected to reach 20% in the year 2017. In California, spending on healthcare was $196 billion in 2004, twice what it was 10 years earlier. Healthcare costs continue to grow faster than inflation. The spending on healthcare in this country is far greater on a per-person basis than virtually every other developed country. We spend double to triple what countries like Canada, Germany, and Spain spend on their citizens for healthcare. And for all we spend, the quality of our healthcare is mixed. We are in the forefront in some areas, but are far from first in many health outcomes that are considered important indicators of overall health. At this moment, about 4.9 million Californians do not have health insurance, and over 6.5 million Californians had no coverage at some point during the past year.
I wish I had a health insurance. Unfortunately, I'm not employed, and I'm studying. I'm actually left my pharmacy tech position, and I'm actually changing careers, and I'm studying to be a pre-need funeral counselor, but I don't have any health insurance.
In a recent survey, 77% of Californians were concerned about not being able to pay the costs of a major illness or injury. And about half of all bankruptcies in the U.S. are due to medical expenses. 3/4 of people with a medical bankruptcy had health insurance when they first became ill. So how does our healthcare system work today, and what can we do about it? A majority of people under 65 in California get their healthcare coverage from their employer or the employer of a family member. Generally, this insurance is paid for in part by the individual and in part by their employer through monthly premiums. When people get medical treatment, they are also charged a copay, such as $20 a visit, and a deductible, that is, the amount that must be paid out of pocket for a treatment before the insurance company will start paying benefits. Of the 46% of Californians who don't get coverage from an employer, 20% are uninsured. 16% get coverage from a public program like Medi-Cal, 6% get private insurance policies, and 4% are covered through other sources like unions and membership associations. It's worth noting that the percentage of Californians receiving health care from an employer has decreased by 10% in the past 2 decades. It also may surprise you to learn that of people without insurance in 2005, 84% were in a family with someone who worked. Many people move back and forth between having insurance and not having insurance at different points in their lives. In addition to those who are insured or uninsured, some people are underinsured, which means they are covered for major medical emergencies but cannot afford more routine treatments or the copays that go with insurance. Others are insecurely insuring and face the risk of losing their coverage due to sudden illness, job layoff, or divorce.
I've been separated from my husband for quite some time now, but we're not divorced, so I still get to carry my take care of insurance through his insurance company.
Health insurance costs are growing at a rate that is nearly double the rate of wages and inflation, placing a substantial burden on everyone. Even those who are insured through their employer may face higher premiums or fewer wage increases because employers are forced to cover higher healthcare costs.
It's an issue for people who are insured but are finding themselves underinsured or insurance costs are going up. And my employer, the Berkeley Unified School District, is complaining that their costs are going up so fast that they can't maintain their budget.
The reasons for these increases in cost range from our aging society to more expensive technologies and treatments. The number of uninsured people in California also increases costs to the healthcare system. When fewer people have health insurance, fewer people are paying into the system. People without insurance still use the healthcare system for treatment when they need it, but they are not paying into the system, and this cost is passed on to those who are.
Each of us has the risk of being sick, but we never know which one of us is going to get sick. What a risk pool is all about is putting a group of people in a common pool so that those who are healthier and those who are sicker end up in the same system. And when one who is sick gets ill, that cost can be spread across others who are healthier.
What can we do about it?
We as citizens begin to realize that we are indeed in this together and that we have the solution if we're willing to openly talk about it.
Now it's your turn to weigh in and make decisions about our healthcare system. The future of healthcare is in your hands.